The Kenya National Union of Nurses has voiced its support for the BBI report that, among other things, recommends the creation of a health commission to handle personnel issues. According to the union, the move will bring to an end the industrial strikes and improve working conditions in the health sector. Francis Talaki has more from Mombasa, where the union officials are attending the ongoing nurses conference.
Today we want to discuss matters to do with health, where the Kenya National Union of Nurses is meeting here in Mombasa for their 2019 conference. Matters to do with health are being discussed here, and specifically for the nurses. With me is Mr. Seth Manyako, the Secretary General of this association. Welcome to Citizen TV, and tell us maybe what are the talking points for this year's conference?
Yeah, this year's conference, we're having a conference. The first one is saying the first East African Labour and Health Workforce Scientific Conference, whose theme is healthcare workforce, sustainable development and cross-cutting disciplines. We are looking at issues that are related to human resource for health workers, and we have different topics that are being brought up by different speakers from different backgrounds. For example, we're looking about the issue of Human Health Services Commission and how it will improve the healthcare delivery. Basically, we are looking about issues in health, the best way of solving industrial disputes within the health workforce, because we are talking about health workforce. We are discussing about the challenges, for example, of professional indemnity. Today we have had AAR Managing Director making a presentation and his team about professional indemnity. As you are aware, the law today requires that all health facilities in Kenya must take professional indemnity as well as health workers, and therefore as nurses we don't want to be left behind, because we have had a lot of problems before. We have issues, you remember, of Kenyatta, where we had a patient who was killed and they wanted to say it was nurses. We spend a lot of money to hire lawyers to represent our nurses. We also have an ongoing case in Kwale and many others. So this conference is basically labor issues in the perspective of health sector.
In talking about the labor issues and what has been happening across a number of counties here in the country, you look at a scenario whereby there have been industrial strike, and what picture maybe are they drawing, and what would you want to see from the counties? Is it that the monies are not there, or the counties have failed in their task to make sure that health has been devolved fully?
One of this workshop has come at a very better time when we have the BBI report has been released. And when we made our presentation to BBI, we said that we wanted the Health Service Commission. You will see that we have an ongoing national wage conference, which is going on in Nairobi, KICC. I happened to attend yesterday, and I was one of the panelists on the health caucus. We were told that from 2013 up to yesterday, or up to June this year, we had experienced strikes that consumed 444 days. That's actually 1 year and almost 1.5 years. Means for the period of 1.5 years, within 2013 and 2019 June, Kenyans did not receive health services. When you look at the cause of the industrial action and disruption of health services, it is actually bordering on very mediocre things that lead people to go on strike, which I say are stupid things. For example, 65% or 75%, between 65 and 75% of the causes of industrial actions at the counties are related to non-payment of salary. Something that never happened in the national government. As we are talking today, Kilifi County government has stopped payment of medical insurance cover for all employees in Kilifi County government. And all of them have given a strike notice. When we were in the national government, our medical allowance was taken away. And the national government crafted a comprehensive civil servants medical scheme, which was being run by NHIF. Now, when the counties came in, the money was taken to them, but they have decided to use that money on other things. So we have industrial actions and disruption of services which are not necessary. And that is why, as a union, we have already said this morning that we are supporting BBI because it has come up with the Health Service Commission. It has listened to the desires and the interests or the wishes of the Kenyan health workers and of also Kenyans, because many Kenyans have said health should not be left in the hands of the county governments. This will eradicate unnecessary industrial actions by at most 75%.
Back to you. My name is Francis Mtulaki. It is back to studio.